problematic because we are giving anticoagulants and report unusual bleeding or bruising. And avoid alcohol and NSAIDs like ibuprofen or aspirin unless approved by the doctor. And notify the dentist or surgeon prior to any procedures that you are on heparin therapy. Because if a tooth is extracted and you are on heparin, there's a tendency of bleeding. So we need to inform doctors before the dental procedures and any surgical procedure, because in surgical procedure also bleeding is a usual thing. So since the patient is on heparin, that can be sometimes dangerous. So we need to inform the doctors, right? Why NSAIDs should be avoided unless the doctor is approved to use it? Why? Why we should avoid NSAIDs?
So bleeding tendency cause.
Yeah, it also has a bleeding tendency because it inhibits prostaglandin synthesis. So prostaglandin is important in platelet formation and the clotting. So therefore, we should avoid NSAIDs unless the doctor approved to use the NSAIDs, right? Okay. Right. We will now move on to other drugs. So now we have discussed what is hemostasis and how the bleeding, stopping of the bleeding happens through anticoagulation process, and what are the important compounds, factors, and then we discussed about one of the anticoagulant drug, which is heparin, right? So heparin is only available as injections, right? Now, we are moving to direct thrombin inhibitors. So what is the heparin mechanism? What is the mechanism of action of heparin?
And
What is the mechanism of action of heparin?
It stimulates the action of antithrombin, so um, coagulation does not happen.
Pardon?
It stimulates the action of antithrombin, which
Okay.
inhibits thrombin. Therefore, coagulation does not happen.
Therefore, what happens?
Coagulation does not happen.
Yeah, does not happen because it will inhibit thrombin, right? Antithrombin will inhibit thrombin. So the coagulation process will not happen, right? So heparin will not directly act on thrombin, right? It will have some effects on antithrombin, and antithrombin will act on thrombin, right? So the drugs that now we are going to talk about are direct thrombin inhibitors. That means they act on thrombin directly. So direct thrombin inhibitors or DTIs act by inhibiting the enzyme thrombin or factor 2A dependent on their interaction with the thrombin molecule. Bivalent heridine derivatives bind to both active site and exosite. You don't have to know like these things. You have to, in simple, to know like it will bind with thrombin and inhibit. And right. So DTI's use is limited to circumstances where heparin cannot be used. Right? So do you know the leech? So we have a animal called as leech, and in the scientific name Hirudinea, right? Then Kudella කියන කෙනා වහලා තියෙනවනේ. So what the Kudella does? what the leech does? What is his food? How does he survive?
Blood.
Blood. So the leech will survive on somebody else's blood. So what happens is it will attach to somebody, human or an animal, and then it will start sucking blood. So for it to suck blood, blood should come out without any disturbance. But there's a process in our body or animal's body, other animals like dogs and others. We all have a mechanism to stop bleeding when there is an injury. So if that happens, the leech cannot suck blood as much as he or it wants, right? Therefore, these type of animals, they have some chemicals to stop the coagulation. So what the leech does is when it gets attached to someone's body, so there will be an injury because they are biting, no? They are biting and attaching to our body. So there's an injury and they secrete some chemicals which will prevent the coagulation, right? So since they prevent the coagulation at that site, right? So the leech can suck the blood without any difficulty and disturbance, right? So those are known as hirudines, hirudine derivatives, right? So from those, they have developed some drugs, hirudine derivatives, and there is another one called ergotrobin. So all these are direct thrombin inhibitors. What they do is they are directly on thrombin and inhibit thrombin. Is that clear? පැහැදිලිද ඒක?
Yes.
Yes, sir.
දැන් අපේ ඇඟේ
Yes,
කූඩැල්ලෙක්
ma'am.
එල්ලුවා. කූඩැල්ලට අපේ බ්ලඩ් සක් කරන්න නම් එයාට කිසිම ඩිස්ටර්බන්ස් එකක් නැතුව ඒක සක් කරන්න නම් මේ කොඇගුලේෂන් එක තියෙන්න හොඳ නැහැ. තිබුණොත් එයාට හරියට බ්ලඩ් සක් කරන්න බෑ. කොඇගුලේෂන් එකක් වෙලා බ්ලඩ් ක්ලොට්ස් හැදෙනවා. right? එතකොට ඒ වගේ ඇනිමල්ස් ලාගේ naturally තියෙනවා chemicals. ඒගොල්ලෝ රිලීස් කරනවා අපිට attach වුණාම ඒ රිලීස් කරන chemical වලින් blood coagulation එක prevent කරනවා. එතකොට ඒගොල්ලන්ට කිසිම මේ බාධාවක් නැතුව blood suck කරන්න පුළුවන්. එතකොට ඒ chemical compound එක තමයි අපි කියන්නේ hirudine කියලා. එතකොට hirudine derivatives අපි use කරනවා drugs විදිහට මේ anticoagulation achieve කරන්න. එතකොට they all are direct thrombin inhibitors where they directly act on thrombin. So one is lepirudine, right? Lepirudine is a direct thrombin inhibitor approved for patients with HIT. What is HIT? Uh, does it explain, Maria? Does it explain in somewhere the HIT? Heparin-induced thrombocytopenia. Yeah. So heparin, because we discussed when heparin is given in high dose, it can also, in that situation, improve the blood coagulation by increasing the platelet adhesion, and also it can cause thrombocytopenia, right? So it can use for heparin-induced thrombocytopenia and obtained from salivary glands after the leach. It's a recombinant derivative of hirudine excreted by the kidneys. Avoid or use cautiously in those with renal failure. Administered IV. Monitor the APTT like in heparin. No antidote is available for that. And we also have bivalirudine, a synthetic amino acid polypeptide that directly inhibits thrombin, used as an alternative to heparin in those with HIT. So because when HIT is there, heparin cannot be used anymore. So we can use these drugs as an alternative, administered IV, reduced dose in those with renal impairment. And we also have ergothrombin, binds reversibility thrombin, used as an alternative to lepirudine and heparin, administered IV and reduced dose in those with hepatic failure. Then we are moving to direct oral anticoagulants. So up to now, what we have discussed are all of them are IV or SC, subcutaneous, anyway, injection form. So they only have injection dosage forms. So direct oral anticoagulants, where we can give some oral forms, right? So what are these? Direct oral anticoagulants, also termed as non-vitamin K antagonists, oral anticoagulants. They are being increasingly used for patients at risk of deep venous thrombosis or DVT and stroke. In fact, they may replace warfarin in the future. They are direct competitive inhibitors of factor 10A, reversibly binding to factor 10A active site and preventing the generation of new thrombin molecules, because we know we need active 10, factor 10 to convert prothrombin into thrombin. So if the factor 10A is inhibited, thrombin will not be formed, right? So they have a fast onset of anticoagulation, fixed treatment dose, unlike warfarin, and there is no requirement for routine lab monitoring, because when we discuss about warfarin, right, warfarin is also oral therapy, but warfarin is a vitamin K antagonist, and when we take warfarin, we need to do routine lab tests, right? Because warfarin is narrow therapeutic drug also. There's a risk, and also we need to do lab testing also on the coagulation, right? And there is no requirement for routine lab monitoring. There are antidotes to reverse major bleeding events. So the drugs examples are dabigatran, rivaroxaban, apixaban, edoxaban, betrixaban. So those are the drugs. You don't have to know each and every one, but maybe rivaroxaban is common in Sri Lanka. Dabigatran, the only detail that can be given orally, its half-life is 12 to 17 hours, but has a rapid anticoagulation effect. So the other drugs are substrates for P-glycoprotein, and concomitant use with P-glycoprotein inducers reduces the anticoagulant effect. They may increase the anticoagulant effects in patients with renal failure. Apixaban and rivaroxaban interacts with the cytochrome P3A4 inhibitor. That means it interacts or inhibits the liver enzyme, meaning it can influence the drug metabolism and the metabolism, right? So if we go, yeah. They are antiplatelets. We will discuss the next lesson is antiplatelets and thrombolytics. We will discuss aspirin and other drugs under that category. Here, the coagulation, right? So in the bleeding process, we have these factors, cascade event of uh, factors and formation of fibrinogen, and the platelet adhesion is separate, right? So either if we can stop this fibrin formation, or if we can stop the platelet adhesion, we can affect or influence the clotting mechanism, right? So in the coagulation, we have heparin. Heparin inhibits the antithrombin, where it inhibits the thrombin. Sorry, heparin induces or the stimulate antithrombin, so it will inhibit the thrombin. And we have what else? Um, direct thrombin inhibitors like hirudin derivatives, and they directly inhibit thrombin. And we have direct oral anticoagulants. So what they do is they inhibit the formation of, they inhibit the factor 10A, right? When factor 10A is inhibited, thrombin will not form, right? And the next one is vitamin K antagonist, which is warfarin. So we have to discuss a little more in there, in the warfarin. Therefore, I will give you like 10 minutes, not more than 10. Go through the pyridine derivatives or the direct and thrombin inhibitors and direct oral anticoagulants. One of the drug, select one of the drug, and dosage forms, and contraindication side effects. Right? Can you all finish that quickly? Then we will discuss the vitamin K antagonist warfarin. Right? That can be given orally. So these dabigatran, betrixaban, edoxaban, so all these are direct oral anticoagulants, right? So they can be given orally and they will stop coagulation. So that is why anticoagulation. So their main mechanism is inhibiting factor 10A, active factor 10. But dabigatran also has a inhibition on thrombin directly too, right? So when you inhibit factor 10A, that you will also inhibit thrombin indirectly, right? So they can inhibit thrombin, but dabigatran will inhibit factor 10A as well as thrombin, right? So that is why it says dabigatran, the only DTI, direct thrombin inhibitor. So direct thrombin inhibitors, earlier we discussed about hirudin derivatives and the other derivatives, but they are only injectables. So dabigatran also can directly inhibit thrombin, and it can be given orally. So that is the only DTI given orally. Is that clear to you all? ඒක පැහැදිලිද? Hello, are you all here?
Yes, Miss.
Yeah. So dabigatran, so what are the other drugs I said? Edoxaban, betrixaban. So the ඔක්කොම direct, direct oral anticoagulants, right? Oral anticoagulants. මේ ඔක්කොම orally දෙන්න පුළුවන්. මේගොල්ලන්ගේ main mechanism එක තමයි factor 10A එක inhibit කරන එක. right? නමුත් මේ dabigatran වල තියෙනවා thrombin inhibit කරන්න පුළුවන් directly action එකකුත්. ඒ කියන්නේ 10A inhibit කරනවට අමතරව යාට directly thrombin උත් inhibit කරන්න පුළුවන්. එතර අපි ඉස්සෙල්ලා කතා කරපු direct thrombin inhibitors ඔක්කොම hirudin derivatives and other injectable forms. එතකොට මේ dabigatran විතරයි අපිට orally දෙන්න පුළුවන් එකම drug එක මේ thrombin directly inhibit කරන්න පුළුවන්. right? So ඒක තමයි මේ මෙතන කියන්නේ. Is that clear? ඒක පැහැදිලිද?
Yes, Miss.
Okay. So now we will move to warfarin. vitamin K antagonist or warfarin. So warfarin acts by inhibiting vitamin K epoxide reductase or VKOR and thereby inhibiting the reduction of vitamin K epoxides to its active hydroquinone form. Right? So this also you need to refer your physiology. So anyway, in simply, when we take vitamin K, it has to convert into its active form. Right? So to convert the vitamin K into its active form, there is an enzyme called vitamin K epoxide reductase. Right? So, mm, and, okay. Um, so I'm trying to get my pen, but I can't write it in the word, right? Okay. So what happens is vitamin K is there when we take it, absorb it, and then it should convert into its active form. You all can say that with me, right? So vitamin K will be converted to what? Say loud with me. Can you all hear me?
Yes,
Hello?
Miss. Yeah.
So vitamin K will be converted to what? තේරුම් නැද්ද ළමයිනේ මොකද කතා කරන්නේ නැත්තේ මොකක් හරි ප්‍රශ්නයක්ද?
Not understanding.
Right? So දැන් මේ නෝට් එකේ ඉපොක්සයිඩ් මෙහෙම තියෙනවනේ හයිඩ්‍රොක්විනෝන් මම ඒ වචන පාවිච්චි කරන්නේ නැතුව what I use in simply is when we take vitamin K it will absorb and get into our blood. So for it to
Yeah.
work it has to convert into its active form. Is that clear?
Yeah.
Right? So this conversion of vitamin K into its active form is done by an enzyme called vitamin K epoxide reductase. Is that clear now?
Yeah.
Okay. So others, Jayani, Janani, Janani, yeah. Tell
Yes,
me
Miss.
what you
Clear.
understand, Janani. Janani, can you tell me what did you understand just now, what we studied? Janani, are you here?
Yes, Miss.
Yeah. So what did we learn just now? We learned something about vitamin K. So can you repeat it? What did you learn now? ජනනි මොකද්ද තේරුම් නැද්ද
Wait.
මොකක්ද ප්‍රශ්නේ? Niroshini, now you said it's clear, but you can't reproduce it. Niroshini, Niroshini, are you here?
Yes, Miss. For me also not clear.
But you all said no. It's clear, it's clear. Now when I ask a question, then it's not clear. Jayani? Yes, what did you understand? Mhm. Mm. Yeah, the enzyme will convert, right? දැන් තේරෙන්නේ නැහැ කිය නෑ හොඳට අහගෙන ඉන්න මම දැන් මේ මහා ලොකු දෙයක් නෙමෙයි මේ කියන්නේ. මම දන්නේ නැහැ තේරෙන්නේ නැත්ති කියලා නා. So Right? So we have vitamin K, right? So vitamin K should be converted into vitamin K active form. මේකේ නම් මේවා මතක තියාගන්න ඕනේ නැහැ. Right? So this happens through an enzyme, vitamin K epoxide reductase enzyme. Right? Vitamin K epoxide reductase is the enzyme which will do this conversion. Right? Is that clear now, Niroshini? Can you say that to me again?
To convert vitamin K into vitamin K active form, it needs an enzyme called vitamin K epoxy
Epoxide reductase.
reductase. Yes.
Right? So, um, okay. So warfarin given orally is highly protein bound or whatsoever. So warfarin acts by inhibiting this enzyme, right? Vitamin K epoxide reductase. So when the vitamin K epoxide reductase inhibited, what will happen? I'm asking the other way around now, right? So vitamin K converts to its active form by the enzyme vitamin K epoxide reductase. So warfarin will inhibit the vitamin K epoxide reductase enzyme. So what will happen?
Stop vitamin K transferring into vitamin K active form.
Yes, so vitamin K will not convert into the active form, so that vitamin K cannot act. Because we earlier discussed vitamin K is important to synthesize coagulation factors, coagulation proteins. So nothing can happen because now vitamin K is not in the active form, right? So it has to convert into the active form to carry out the functions, right? So warfarin will inhibit vitamin K epoxide reductase and converting the vitamin K into the active form. So it is given orally and it is highly protein bound. Half-life varies 25 to 60 hours and the pharmacological effects of warfarin will take at least 48 to 72 hours to develop. Therefore, concurrent bridging therapy with unfractionated heparin or low molecular weight heparin is needed when someone is started on warfarin, right? So warfarin has a long half-life, but the action will be shown within like 3 to 4, or 4 to 5 days. Therefore, until that, we need to use a bridging therapy with heparin, unfractionated heparin or low molecular weight heparin. ඒ කියන්නේ warfarin වලින් මේ effect එක එන්න දවස් ගාණක් යන නිසා එතකන් අපි වෙන ඊට වඩා ඉක්මනට action එකක් දෙන drug එකක් එක්ක පටන් ගන්නවා. එතකොට මේ දවස් 4ක් 5ක් අපි ඒ drug එක දෙනකොට ඒකෙන් control වෙන්න පුළුවන්. warfarin වල action එක පටන් ගන්නකම්. Uses of warfarin prevent progression or recurrence DVT or pulmonary embolism, prevent venous thrombosis and those undergoing post-MI to prevent recurrent ischemia, chronic arterial fibrillation. This is angina. We will talk about the atrial fibrillation in angina. Prosthetic heart valves to prevent blood clots, right? Blood monitoring. Monitoring of baseline prothrombin time prior to starting warfarin is recommended. Warfarin is dosed based on the target international normalized ratio and hematology guideline in oral anticoagulation. Target INR goal depends on the condition being treated and ranges from 2.5 to 3.5. Duration of treatment is based on the condition being treated, recurrence of thromboembolic events and warfarin-related bleeding events. Adult dosage starts from 2 mg per day by mouth and is tapered according to INR. Warfarin can also be given IV. Dietary changes, excessive consumption of green leafy vegetables, salads should happen. Consumption and alcohol consumption and several medications interact with warfarin and may affect warfarin control. So if we discuss again this, before starting the warfarin therapy, it is good to see prothrombin time. Prothrombin time is a test where you can have some understanding about the clotting time, right? Then warfarin dose based on the target international normalized ratio. So international normalized ratio is also some measure, test and some value that will give you some understanding about the coagulation time, right? So we have a target. So normal person should have less than 1.8 INR, right? But if there is a problem, depending on the disease, we have different INR values as a target, right? ඒ කියන්නේ INR value එක කියලා කියන්නේ අපිට blood coagulation time එක ගැන අදහසක් ගන්න පුළුවන් test එකක් සහ value එකක්. හරිද? test එකකින් පස්සේ අපි ලබා ගන්න යම්කිසි අගයක්. ඒ අගය normal අයගේ 1.8 වලට වඩා අඩුයි. 1.8 හෝ ඊට වඩා අඩු වෙන්න ඕනේ. නමුත් disease තියෙද්දි අපිට මේ normal තත්ත්වෙම සමහර වෙලාවට achieve කරන්න අමාරුයි. එතකොට එක එක disease එක අනුව අපිට targets තියෙනවා. අපි මේ ගාන achieve කරොත් හරි. අඩුම ගානේ මේ ගාන. එතකොට disease condition එක අනුව ඒවා වෙනස් වෙනවා. එතකොට සාමාන්‍යයෙන් warfarin වලින් අපි warfarin දෙන disease condition එක අනුව මේ value එක පොඩ්ඩක් එහෙට මෙහෙට වෙන්න පුළුවන්. සාමාන්‍යයෙන් 2 3.5 අතර තමයි ඔය මොන disease එකටත් range එක යන්නේ. 1 2 3 කියලා සමහර disease වලට, සමහර disease වලට 2.5 3.5 කියලා අපි මේ goal එකක් අපි තියාගන්න. හරිද? එතකොට අපි warfarin start කරාට පස්සේ මුල දවස්වල දවස් 2-3කට සැරයක් මේ INR value එක test කරලා අපි dose එක adjust කරන්න ඕනේ. එතකොට අපි ඒ කියන්නේ අපිට expect කරන විදිහට අපි මේ coagulation එක වැඩියෙන් සිද්ධ වෙන්න හොඳත් නෑ, අඩුවෙන්ම සිද්ධ, ගොඩාක් අඩුවෙන් සිද්ධ වෙන්නත් හොඳ නෑ. ඒ හින්දා අපි මේ target එකට යන්න ඕනේ. එතකොට මේ ඒක achieve වෙන විදිහට අපි dose එක එහෙට මෙහෙට කරලා මුල දවස්වල දවස් 2-3කට සැරයක් මේක බලනවා. පස්සේ සති දෙකකට හරි මාසෙකට සැරයක්, සාමාන්‍ය මාසෙකට සැරයක් බැලුවහම ඇති. right? එතකොට duration එකත් මේ treatment duration එකත් disease condition එක අනුව රඳා පවතිනවා. හරිද? okay. දැන් ඒ ටික පැහැදිලිද? hello, are you
Oh,
all here? right?
yes, Miss.
Why
Yes,
do
Miss.
we need to check INR? Now you should have some understanding why it is important, because we are inhibiting vitamin K synthesis, or like vitamin K in the sense, right? So adult dose start from 2 milligram per day by mouth, and warfarin also available in injectable forms, IV. So dietary changes has to happen, right? Because it inhibits the vitamin K active formation. Therefore, we need to take vitamin K from our diet. So if we inhibit vitamin K as well as if we don't take enough vitamin K, there can be a problem, because we are not going to 100% inhibit all vitamin K. We are going to reduce the coagulation, right? So we need to make sure we take enough vitamin K by taking green leafy vegetables and salads. And we have to avoid alcohol consumption, because if you take alcohol, it can be a problem, right? And as we know, warfarin is a narrow therapeutic drug. So what do you mean by a narrow therapeutic drug? What do you mean by a narrow therapeutic drug?
The difference between safe effective concentration and minimal effective concentration is low.
Yes. So that means in simple terms, it can easily become toxic, right?
Yeah.
By increasing a little amount of the dose, it can go toxic. So because of this, it has a lot of drug interactions with other drugs, right? Because there are certain drugs which can affect the liver enzymes. We know there are liver enzyme inhibitors, liver enzyme inducers, right? So if there are liver enzyme inhibitors, those drugs, if the warfarin is taken with liver enzyme inhibitors, then warfarin metabolism will be reduced than normal or than expected. Therefore, warfarin concentration can go high and become toxic, and they can give you toxic effects. So that is why warfarin has a lot of drug interactions. So it has to be very carefully monitored, or when the patient is prescribed with other drugs, prescribed other drugs for certain other diseases, doctors and pharmacists has to be carefully analyze that, right? Is that clear?
Yeah.
Amaya, are you all here?
Yes, miss.
Okay. So hemorrhage is the major toxicity of warfarin. INR more than 5 requires withholding the dose or stopping warfarin based on active bleeding events. Checking INR and omitting doses according to guidelines given is essential. The cause of the INR to be elevated should be investigated. For serious life-threatening bleeding events, there is a warfarin antidote, which is vitamin K. So if we give more and more vitamin K, we can reverse the effects, right? So vitamin K or like phytomenadione is vitamin K. Vitamin K එකටම අපි කියන නමක් තමයි phytomenadione. So it's administered by slow IV infusion, dried prothrombin complex factors or fresh frozen plasma can also given, but is less effective. Teratogenic birth defects and abortion is reported if warfarin is given during pregnancy. Therefore, warfarin is contraindicated in pregnancy. Warfarin-induced skin necrosis, greater incidences in patients with protein C or protein S deficiency, but it is rare. Purple toe syndrome, blue tinged discoloration on the side of the toes may develop 3 to 8 weeks after starting warfarin. Others, alopecia, urticaria, dermatitis can happen. Accidental ingestion of rodenticides containing long-acting vitamin K antagonists like bromelain, diphenhydramine, pindone require high doses of vitamin K to reverse bleeding. Right, so this is something extra to warfarin, because we know warfarin is a vitamin K antagonist that we use as a drug. But in rodenticides, that means rat killers, right, rat poison, they have compounds which contains long-acting vitamin K, right? So if it is accidentally or purposefully ingested, this rat poison, we need to give high doses of vitamin K to reverse the effects. Otherwise, a person can die by bleeding, right? Direct thrombin inhibitors at by inhibitor A. So that is about warfarin. So we will look at the contraindications. Warfarin is contraindicated in pregnancy and active bleeding or high risk of bleeding, recent or upcoming surgery with high bleeding risk, severe liver disease, uncontrollable hypertension, hypersensitivity to warfarin or any component, non-compliant patients or those unable to monitor regularly, special instructions, regular monitoring of INR, diet, we should maintain intake of vitamin K rich foods, drug interactions. Warfarin interacts with many drugs, including antibiotics, antifungals, antiepileptics, and herbal supplements. So these interaction can increase or decrease its effect. So when a person is taking warfarin prescribed, so you have to inform him not to change their diet, or when they are taking any other new thing, to be careful, even herbal supplements, right? Without doctor's advice, not to take those things. Patient education, patients should be educated on the signs of bleeding and advised to use a soft toothbrush and electric razor. Avoid activities with high risk of trauma. Bridging therapy may require bridging with low molecular weight heparin when initiating or discontinuing therapy, especially in high-risk patients. Pregnancy and breastfeeding, contraindicated in pregnancy. However, it is considered safe during breastfeeding, right? So can you all now write about warfarin, like summarize what is warfarin, what is its mechanism of action, and what are the important things. That means like you have to check your INR and then adjust dose. And even after that, even establishing, you need to check regularly the INR. What are the instructions that we have to give to a patient? Can you write down that? After that, we will compare certain drugs that we have learned up to now. I will just give you 5-6 minutes to finish offering. Look at the contraindications, doses, side effects in the BMF. And like, yeah, I will give you 7 minutes. After that, we will compare. Okay. දැන් අපි ඉගෙන ගන්නේ ඇන්ටිකොඇගුලන්ට්ස් ගැනනේ. එතකොට ඇන්ටිකොඇගුලන්ට්ස් කියන්නේ ඔක්කොම මේ blood clot formation එක prevent කරන අය තමයි. නමුත් අපි විවිධ drug categories කතා කරා. විවිධ මේ mechanisms of actions තියෙන. ඒ මොකක් හරි mechanism එකක ඉන්නේ ආ clot formation එක නවත්තන්නේ. එතකොට prevent කරන්නේ මොනව කරලාද? දැන් මම වෙනම white board අරගෙන පැහැදිලි කරා. එච්චර දේවල් කරලත් දැන් ওই වගේ උත්තරයක් දෙනකොට ඇත්තටම මගේ කාලයයි මගේ මහන්සියයි ගැන දුක හිතෙනවනේ ටීචර් කෙනෙක් විදියට මට.
Heparin promotes the action of antithrombin, and antithrombin inhibits the thrombin.
Yeah. So that is the mechanism of action. ජනනි
As
මොකද
a result, fibrinogen turn to fibrin won't happen.
Yes. So coagulation prevention happens through the mechanism that Sarah now explains. Right? At least you should have told Janani it will promote or activates or stimulate antithrombin 3. කියලාවත් කියන්න ඕනේ. antithrombin කියලාවත්. මොකද ජනනිට අද වෙලා තියෙන්නේ ඔන්ලයින් ඉන්න හින්දා බොරුවට ලොග් වෙලා ඉන්නවා නැතුව. දැන් මම අහපු ප්‍රශ්න දෙකටම අද හරියට උත්තර දුන්නේ නැහැ. නමුත් ඔය ක්ලාස් එකේදී හොඳට වැඩ කරන ළමයෙක් කියලා මම දන්නවා. එහෙම වෙන්න එපා. මොකද මම ඔන්ලයින් තිබුණයි කියලා නැහැ. මම ඒ විදිහට එක්ස්ප්ලেইন කරනවා. සමහර තැන්වල මම දෙතුන් පාරක් එක්ස්ප්ලেইন කරා. තේරෙන්නේ නැත්නම් ආයෙ එක්ස්ප්ලেইন කරා. එතකොට ඔය වගේ උත්තරයක් නම් කොහෙත්ම ඇක්සෙප්ට් කරන්න බෑ. වැරදි උත්තරයක් හරි දුන්නා නම් මට ඇට්ලීස්ට් මේ කියන්නේ විටමින් K ඇන්ටැගොනිස්ට් හරි මොකක් හරි මෙකැනිසම් එකක් කිව්වනම් මට ඒක ඇට්ලීස්ට් මේ bearable but මේ clot formation එක නවත්තනවා කියන එක මේ mechanism එක නෙවෙයිනේ. They are anticoagulants, yes. Right? So ජනනී මේ කොහොම හරියන්නේ නැහැ හොඳේ.
Okay, Miss.
Okay. So can you at least tell warfarin mechanism of action? warfarin වල mechanism of action එකවත් කියන්න පුළුවන්ද? අහගෙන හිටියේම නැද්ද? අහගෙන හිටියේ නැත්නම් මෙතන මේ නෝට් එක දැන් දාගෙන ඉන්න එකේවත් තියෙනවා උතන mechanism එක ලියලා. අනුගානේ ඒක බලලවත් කියන්න එපා. අනේ මන්ද දරුවෝ මන් දන්නේ නැහැ. ඉතින් මට පුළුවන් උපරිමයෙන් මං කරනවා. So it's up to you all. Right? So warfarin, anyone wants to tell the mechanism of action?
Vitamin K is converted to its active form by an enzyme called vitamin K epoxy reductase, and warfarin inhibits this enzyme, so vitamin K never becomes its active form. So through this mechanism, blood does not coagulate.
Yeah. So warfarin, so very good, Namindu. So warfarin K act as a vitamin K antagonist, right? So that word also you should remember, vitamin K antagonist, because when they give questions, they will use this word vitamin K antagonist, right? So the direct thrombin inhibitors that we talked about earlier, or direct oral anticoagulants, they are not vitamin K antagonists. Only warfarin is vitamin K antagonist. So we talked about the rat poisons. Rat poisons also has long-acting vitamin K antagonists. So we have to give vitamin K as an antidote. So onset of action is given. So for monitoring is required for warfarin because we need to monitor INR. For heparin, we need to monitor APTT. For DOACs, generally, we don't have to do routine blood tests, right? And reversal agents or antidotes, warfarin, we have a antidote vitamin K, protamine sulfate for heparin, and for direct oral anticoagulants also. Maybe. So we have antidote known as idarucizumab for these dabigatran and dextratan alpha and factor 10A inhibitors, right? Uncommon uses is given. Dietary restrictions are there for warfarin, because we need to take vitamin K rich food, and heparin and DOACs, we don't have a particular dietary restriction. And advantages, warfarin is well-established therapy and it is cheap. Heparin is a rapid action, and DOAC is fixed dosing and fever interactions, because we know warfarin, it has a lot of drug interactions as well. So disadvantages are narrow therapeutic index, warfarin and heparin interaction required risk of HIT, heparin-induced thrombocytopenia. DOAC is cost limited reversal agents for some DOACs is a disadvantage. So this is just a summary. Yeah. So do you have any questions to ask?
Miss, can we see the summary table?
Pardon me? Yeah, I will share
Can
this one with them and they will send to you. I will
okay.
just after the class I will share with them, but it will take time, right? Yesterday also I shared the note in the morning, but they have shared it in the evening. So somehow
Okay.
within the day I hope it will share to you. Yeah. So next week we will do antiplatelets and thrombolytics, right? So today we did anticoagulants. So the drugs which will involve in the cascade of these factors and formation of fibrinogen. So that is known as anticoagulants, and we have separate drugs called antiplatelets. So which will act on and platelets, thereby inhibit clot formation, right? So clopidogrel, aspirin, and all these drugs will be learned in the next week, right? Okay, so anything you want to say? Right, so if you have no questions, I will stop for the day. Thank you very much, and please complete your notes today, and at least just go through it once and try to memorize things. Right? For example, like warfarin contraindicated in pregnancy, INR should be monitored. So something like that. So those important features and the mechanisms, just memorize and remind them time to time. So you don't have to study by heart when the exams are near. Right? Okay, then. Thank you very much. Have a good
Thank you.
weekend.
Thank you, Miss.
Thank you, Miss.